Yeah, there hasn't been much of a change since the last meeting. Obviously, the year closed, so we're closing out the books. So we'll know more about kind of final numbers after our kind of last minute adjustments for the end of the year. So I don't know if there's any specific questions.
Does anyone have any questions for Lindsay while we're waiting on Helen?
Helen, are you there?
I'm here.
Oh.
How's everybody?
We are doing well. Sorry for the confusion, Commissioner.
That's fine.
So if you want to, and thank you for the update, Lindsay, we'll circle back around to you. Commissioner, if you want to give us your update as well, and then we'll open the floor for questions. And Solicitor, you certainly can chime in on anything that you might have to offer also.
Why don't you keep going? I need to get my book in front of me, and it's not, so if you all don't mind continuing on, unless you're just totally waiting for me.
Absolutely. Does anybody have any questions for Lindsay?
Well, I'll try one. So Lindsay, when you said it's the same as it was last time, a couple weeks ago, you mean the reimbursements for COVID-19, et cetera?
So we haven't had any additional COVID reimbursements. We just submitted that grant to the state, and we have already received that funding. Spending on that has been pretty level for the COVID stuff. So we haven't gotten additional reimbursements from that.
And who do we submit to? Who are the entities that are offering grants or reimbursement?
So we have money that has come in from HUD. We have money that's going to be submitted for reimbursement to FEMA. We have money that has come in specifically for public safety use. We have money that has come in directly through the state. So there is a lot of different sources that we have, and we're tracking all the sources and all the potential uses, and then all our costs and our needs, so we can figure out the best way to make sure we get kind of the biggest bang for our buck with all the needs for the city. And
yeah, is there deadlines on any of these applications, or is it rolling?
For now, it's rolling. But for instance, and obviously this is all up to change, but for instance, the state funding is good for expenses through all of calendar year 20, so beginning in January and in December. But again, that's all up for potential changes.
Okay. Great.
Thank you, Councilor Allen. Councilor Davila.
Yes, thank you, Mr. President. Good morning, Lindsay. You answered my first question. So we are still waiting for some disbursement for some of the grants that we approved, correct?
I'm sorry, I didn't hear you.
Just so I understood you correctly, you just said that we are waiting for some money to come in from the grants that we approved.
No, the state money has already come in, and the other grants that have come before you for COVID-related expenses, those are reimbursed on a rolling basis when we submit actual costs.
Okay, I see. Now, is there any other grant that we are pursuing? Are we actively seeking other revenues from grants as we go forward?
I assume there's going to be additional funding sources, yes.
Yeah, specifically for COVID-19.
Yes.
Okay, all right, thank you.
All right.
You're muted.
Okay.
I'm sorry, Commissioner. Yes, ma'am. I'm sorry. The floor is yours. My apologies. I'm doing double duty here.
Let me start by apologizing. I did Pastor White's event yesterday evening, and I, for some reason, was not tuned into my calendar. So thank you for your patience with me. I am extremely appreciative. So where we are right now in the city of Springfield is that we have 2,659 cases. Hampden County, 6,091 cases. We have 109,143 Total cases, 5,285 of those are probable. Springfield, again, 2,659. We are still 39% of Hampden County, 2.43% of the Commonwealth of Massachusetts. Our deaths are 8,081 in the Commonwealth. In the city of Springfield, we are at 120 deaths right now. 55 of those deaths continue to be white. 36 are Hispanic, 27 are Black. Let me break out the percentages for you. 45.83% are white, 30% are Hispanic, 27 are Black, which is 22.5%. We still have 2 Asians, which is 1.66%. 3 of those individuals are between the ages of 40 and 49. 8 are between the ages of 49 and 59. 33 are between the ages of 70 and 79. 35 are between the ages of 80 and 89. 21 are between the ages of 90 and 99. 66 of those individuals report residential address, which equates to 55%. 54 of those individuals come from long-term care facilities, and that is 45%. We continue to push on the 3 types of prevention. Primary prevention, I have sent out notifications around the design to reduce COVID-19 to the general population. And you know what those are, the face coverings, as well as the social distancing, stay home if you are sick. Let's see, face covering, social hand hygiene, hand washing is the one I did not mention. I have sent notifications to high density areas in Spanish and English to individuals who live in those areas. Although Massachusetts is doing well, I continue to be concerned about a resurgence based on the fact that there are states around us who are increasing in cases. So what we want to be able to do is make sure we're communicating with those hot spots. And so my staff is trying to do as much as we can to work with community-based organizations to the degree we can and get those messages out there in multiple languages. They continue to be available on the city's website, as you know. Secondary prevention, the interventions that are named at people who are at risk or people who are already infected. We continue to do the contact tracing in-house because of the low numbers at this point. So all contact tracing is being done by staff, and it is doing well. People are responding to us. Again, I continue to be concerned about face coverings in public. We know we're going into the 4th of July weekend. I just think it's very important that we stress that. You probably also know that the Commonwealth has sent out an alert to all of us saying that if you are hosting relatives from particularly those high areas where we're seeing the numbers go up, and you know what they are, Arizona, California, you know, there are incidences happening across the South, North Carolina. We're seeing record numbers. And so if you look at high areas where the numbers are going up, if you have relatives coming in from those areas, we're going to recommend, and the state is recommending, that those individuals self-quarantine for 14 days. If you as a council or any family members or the public are traveling out of state and coming back in again, we are asking that you self-quarantine for 14 days. The tertiary prevention has to do with hospitalization. The hospitals tell us that they are ready to receive individuals if they need to. They've got plenty of capacity in the western region. My warning is if you live in a high density area and you're over the age of 65 or you're over the age of 65, if you are Black or brown in this community and you have underlying conditions, asthma, cardiovascular disease, high blood pressures, if you are immune compromised, the data is telling us those individuals are high at risk. And so we're asking individuals to take precautions if they know they are at risk and they fit into some of those age categories. Contact tracing, I just mentioned, we're continuing to do that and people are responding. Isolate. If we call and an individual has been given notification of a positive test result, we're asking individuals to isolate themselves. So you know that isolation is one thing, quarantine is another one. So if we have contacts, we're asking those individuals to quarantine. Testing, we still are not where we want to be as far as testing is concerned. However, we are doing better. The better means that what is happening is the Bay State still has their sites, which is Carew Street, High Street, and in Brightwood. We have the ability to have individuals tested. All they need is a physician's note. So if anyone in the public feels as if they need to be tested, they should go to their primary care physician. That physician should give them a note. It doesn't have to be symptoms. They just need a note from a physician at this point, and we are testing at those 3 sites. Cooling centers. Initially, we were not going to do cooling centers because of the facilities that we use. Cooling centers were, in senior centers, and so we're not going to use those facilities. However, we are going to stand up cooling centers at Greenleaf, in Mason Square, in the community room, not in the library. Kindleflick Park in the North End will have a cooling center, and in Indian Orchard. Myrtle Street, the center in Indian Orchard, will also be stood up as cooling centers. So we will have 4 around the city. They'll operate from 12 to 7. We will have them fully staffed. You know, we open cooling centers when the temperature reaches 90 degrees or above. We have bought the supplies, the water, and what is necessary, and the staff is ready. This is mosquito season. My staff is out larviciding. You know, we don't spray in the city of Springfield, but what we do is put larvicide into the storm drains, into the sewers, so that we can try to control the mosquito population that way. I have sent out the advisories around dusk to dawn, covering. We still are concerned about West Nile virus, certainly, and triple E. That's the potential. We have not seen high risks in the city or in the Commonwealth, particularly the city, over this last mosquito season. However, I continue to ask individuals to take care of themselves by using DEET, by using spray that contains the appropriate amount of DEET in it. So mosquito season, cooling centers. The last thing is heat stress. I'm concerned always about heat stress during this time, particularly to the individuals who are elderly. We know that it poses a threat and it can put a strain on the body. And if it becomes too great, it can do serious and permanent damage, even death. So the medical chronic diseases we're concerned about as far as heat are concerned are high blood pressure, diabetes, a weak or damaged heart, infection or fever, or individuals that might have circulatory problems, skin disease, particularly, and other things we are concerned about is obesity or individuals who have had a previous stroke are individuals who are at greatest risk. I am asking individuals to check on family and friends during this time, particularly our elders with COVID-19 and then heat. And we're really going into a season that I'm just wanting to make sure we're alerting individuals about mosquitoes, the weather, and the fact that we continue to need to be vigilant as far as heat is concerned. As far as the Office of Racial Equity is concerned, I appreciate everyone's patience with us as we absolutely try to stand this office up. I am very, very grateful for the recommendations that I've gotten from city councilors, and I look forward to working with each and every one of us. So I just finished some language around the job description, and I won't go into it because I know I'm probably time limited at this point. But the job description simply says we're committed to disbanding racism, and in order to address the racial injustices, we want to create policies that will influence the reform of current structures and systems, negative impacts on health outcomes of historically marginalized and oppressed population. So the Office of Racial Equity is really our commitment to lead with race to address health inequities and health outcomes. It goes into a little bit more, and I won't, go into the whole thing, but some of the key responsibility will be to draft a strategic plan to address systemic racism in the city of Springfield, and take note of those department, agencies, and organizations to prioritize, including key strategies to work towards achieving a healthy Springfield, coordinate and provide support to strengthen practices and promote racial justice and health equity, develop and strengthen our partnerships amongst other municipal departments, public schools, fire departments, Springfield police department, and really work with our community-based organizations. So we're going to coordinate with community organizations to develop a cohesive network of health equity and ensure that the use of racial justice and health equity lens in all program and efforts that are carried out. We're going to need to do research around culturally relevant and appropriate practices that are evidence-based and advance health equity and racial justice. And we certainly will work with the State Department of Public Health around the Office of Racial Equity. And I will say that the State Department of Public Health is looking forward to working with us. They do have an Office of Health Equity, and they're looking forward to collaborating with the city of Springfield. I want to develop some data tools and information for residents to enhance their advocacy around health inequities and promote awareness and racial justice needs in the city. And then it says the other duties as required. I do have some qualifications here that I won't go over. I'm giving you that information. I think when we met on Tuesday or Wednesday, was it Tuesday? I may have been just broad in the microaggressions and also talking about the issue of racism, but I wanted to just put a little bit of meat on the bones. I'm not finished with the job description. It's still a work in progress for me, but those are some of the key responsibilities that I see in the Office of Health Equity and Racial Justice. I have not sent this job description at this point to the mayor, so I'm telling you actually before I've talked to him about this, but I'm sure that he will agree with some of these components. He may want to add something, I'm not sure, but those are some of the things that I see as I continue to work towards assuring that this office is positioned in the state, and we are just uniquely positioned to do good work. I will stop there, and thank you for your patience. And once again, I am so appreciative of the fact that you have allowed me to have this conversation and that you have had patience with me as I joined the call late. Thank you.
Thank you, Commissioner. And as always, you did a great job on Pastor Our Two White show yesterday. So well done. Councilor Whitfield, I see you have your hand raised in the queue.
Thank you, Mr. President. Thank you, Commissioner. You did do a great job yesterday. My question is about the street outreach program. I don't know if you all started working on the street outreach program, but I was wondering if there's a specific model that is going to be used or if there's been any communication on that.
So I want to be clear, Counselor, the street outreach portion of the Office of Racial Equity is not an area that was a part of my original vision for the office. And so I am going to look to those individuals in the community who are skilled in street outreach and who have had relationships with our youth in the past. I am hopeful that we'll be able to stand up several youth advisory committees. And, you know, we do have ordinances around that in our city already. So maybe we can talk with the administration, talk with the mayor, and he may be willing to repopulate our youth commission. That is an ordinance in the city. So hopefully we have the youth voices at the center of this. As you know, Daryl Moss really does have the more intensive background around street outreach and how we should move forward as far as, you know, what that looks like. And so I will be leaning on him as well as those individuals in our community who are already doing that amazing work.
Thank you very much.
Thank you, Councilor Whitfield. Are there any other questions from the council? Solicitor Pakula, did you raise your hand?
Oh, yeah, I have a couple updates when you're done with Commissioner Fulton.
Okay, okay, beautiful. Councilor Davila.
Thank you, Mr. President. Good morning, everybody, and good morning, Commissioner. Just a quick question. I know the cases in the city have gone down, and you alluded that the around us, many of the states are surging or starting to have a second wave. I know it's kind of hard to predict, but I would love to hear your opinion as to when are we most likely to get a second wave in increasing cases? Do you think that the 4th of July is going to play a role in that? I know it's kind of difficult, but you know, I'd love to hear your thoughts.
So yes, the cases in the city of Springfield are going down, and we are extremely grateful about that. I think all of our concerns, the second wave, as you know, as a country, we have not come out of the first wave. If you think about that, the Commonwealth of Massachusetts is doing well, but we are still in the first wave. The second wave, really, I am extremely concerned about the fall. And the fact that we are going to be dealing with a flu season, we are also going to be dealing with the potential of COVID-19. So I am at this point partnering with organizations and agencies, particularly standing up a new program with AMR, where we're going to be able to put our paramedics and EMTs in place to be able to do flu vaccines, as well as help us should we have a COVID-19 vaccine, so we can do population vaccination through our COOP plan, which is our continuity of operations plan, to be able to vaccinate or give flu shots to the entire population. That's a long way of saying I think that the concern for all of us in public health has to do with the fall and worrying about flu season, as well as worrying about the potential for a resurgence of COVID-19.
Thank you, Commissioner. That sounds like I'm glad, it sounds like a good long-term plan for the fall. And with regards to, I just read here on the news, the casino have been given the green light to open. I know that at least in Springfield, that's not the case yet. But if I would like to make a suggestion that before MGM opens, perhaps they could give the council a brief presentation as to the safety measures and preventive measures they're going to be taking specifically, because to me that's a concern. You know, we're going to have people from God knows where coming into the city, and just a suggestion that maybe Mr. President, we could have a presentation from the MGM team before they open.
Yeah, thank you. We are, MGM has reached out to the Department of Health and Human Services in the past. As you know, there were 6 restaurants as well as a tobacco shop that we permit. And so they have reached out to have a conversation about what they need to do when they open up, as far as their restaurants and those retail places that we permit are concerned. So I think it's probably critical for the council president to schedule that presentation by working, I think Mr. Delgado is still the government and community liaison, and so I think that's an excellent idea, and we certainly have heard from them as far as their restaurants and opening is concerned. So we will be meeting with them as a Department of Health and Human Services.
Thank you, Commissioner.
I appreciate that, Commissioner, and thank you, Councilor Davila. What I'll likely do is coordinate with Councilor Fenton, who is the chair of the Casino Oversight Committee, since we're now, at least by Monday, opening it up to subcommittee meetings and see if he might be able to hold a subcommittee on that topic. So I will follow up with you, Councilor Davila. Are there any other questions for the Commissioner? If not, we will turn it over to the solicitor.
Thank you, Mr. President. Picking up on some of the comments with regard to COVID and MGM, my recollection is that phase 3 is supposed to start for reopening in Massachusetts on the 6th, Monday.
Okay.
And assuming that that happens, we're likely to see MGM opening within a week or at most 2 after that. So that's sort of the timeline that I've been working with. And in fact, I have a meeting on Monday with MGM about some reopening. So the scheduling of that might be timely later next week. I wanted to also provide you updates on 2 other matters. One is the opioid litigation, and 2 is the coverage of the city council by the law department. In the budget meetings, Mr. President, you brought up the issue of talking to the council about how we're going to do the coverage. And I wanted to let you know that I've reached out to former city councilor Kenneth Shea, who is also an attorney, and to see if perhaps we may be able to enter into some sort of legal arrangement with him to provide coverage, particularly with regard to your hearing nights and any matters related to real estate transactions. And as that is his specialty in the law, I think that he also may be helpful with regard to some of our school committee matters, as he used to be a school committee member as well. And so he could maybe be a liaison for us with the school department. So I wanted to let you know that that's in the works, and I'm hopefully we can pull that off, and then that will give you a regular person who will be attending your hearings meetings, in particular related to special permits and real estate matters. As to the other evenings or other meetings, I certainly will continue to provide services, but I've also spoken with Attorney Tom Moore, and I think you have seen that he has made himself available, and we will probably continue using his services, as well as Attorney Alicia Days and Attorney Kathleen Breck, both of whom are deputies, and also my deputy, Attorney Lisa D'Souza. So what we want to do there is to assure there's some continuity, that if a matter comes up, the lawyer who's handling the meeting, when the issue comes up, stays with that issue. So if it goes to committee, that lawyer would be assigned to the issue that came up during their coverage of that meeting. And so hopefully we're getting you more bodies and can provide you the services that you need to do your work. I know there's a lot of people talking about not working during this. I can tell you the work in this department has gone through the roof. But we're working on additional resources, and I want to thank you for the budget, which has now solidified our ability to move forward on some of those things. So the third issue is opioid. And just by way of background, I wanted to just refresh your recollection, if I could, of the fact that, there's opioid litigation going on nationwide. And most of the cases have been gathered together in what's called multi-district litigation in the Northern District of Ohio. Springfield took a little different tact. Springfield retained the services of Scott and Scott to file suit here in Massachusetts. And when the defendants sought to remove it to federal court to join with that multi-district litigation, Springfield, along with these other communities, fought that motion to keep the matter and have it remanded back to state court. And we were successful in those efforts. And that case has now been transferred to Suffolk County, where it is joined with a companion case. So the companion case that's pending for Springfield involves the city of Boston, and then there's our case, and then there are other municipalities, in particular Worcester, Canton, Framingham, Gloucester, Haverhill, Linfield, Salem, Chicopee, Wakefield, Cambridge, Natick, and Randolph. And so that has been churning along in Suffolk County, despite the COVID sort of interruption, if you will. And but mostly what's been going on is a lot of complicated case management motions. And Judge Sanders on June 24th issued an order that she wants the case to go forward on what's called a bellwether type of process. And so she has designated the city of Boston and the city of Springfield to be the bellwether cases that are going to go forward in the opioid litigation pending here in Massachusetts. So we are now gearing up and responding to discovery requests, setting forth some of our damages and our theories of liability and causation of those damages. And the law department is working with police and fire and schools and IT and all the other departments as we gather all of this voluminous data and with the help of our lawyers, putting it all together to support our case. So that is what's happening there. And, you know, we're still far away from trial, but as I said, the judge designated Springfield to be one of the bellwether cases along with Boston, and that is going forward. So those are some of the updates that I have for you, and I'll be happy to answer any questions.
Thank you, Solicitor. Counselor Whitfield, I see your hand is raised in the queue.
Thank you. Solicitor, can you please explain a little bit more what bellwether means?
Sure. So
Okay.
Lots of times cases come along and they have a lot of the same issues. You may be familiar with what's called a class action,
Yes.
which, you know, and this is a similar situation. In the opioid, we don't have a class action. We have a bunch of individual cases because all of us have a few unique aspects. And so while there's similarities, there's also differences, and that's why we've all got our own case. So like a class action where everything gets tried together, the judge here has designated the bellwether plaintiffs on cases to go forward. This is something similar to what happened in the education reform litigation dating back to the early 90s, which led the legislature to change the ed reform bill, and then most recently there was another the end of that case, where again Springfield was one of the plaintiffs that was part of a bellwether measure, if you will. So we're going to be really the subject of most of the litigation. And then the rulings that come out of that litigation will probably be applied to all of the other cases. So that's a summary of what it means.
Thank you very much. Mr. President, I have one
Yeah.
more question, but it's not regarding the litigation he was just addressing. So I wanted to know if anybody else had a question regarding that before I ask my additional question.
How about you go for it, Counselor Whitfield?
Okay. So, Solicitor, we had got notification that some of the marijuana retail permits were approved. And I had got an email that we were going to discuss the process for the permitting here in Springfield. And then that meeting was canceled, and then I didn't hear anything else. Is anything moving forward as far as the retail marijuana goes?
Yes. So I can give you an update on what I have. Number one, as you know, we've entered into four host community agreements, and then we issued 3 special permits. There's a lot of feedback here, but can you hear me okay?
I can.
Yeah, I'm getting the feedback as well.
I don't know who.
I don't know. Somebody is unmuted. I think we should all mute and let Solicitor.
Okay, that seems better.
Much better.
Thank you. So now all 4 of the applicants who had received host community agreements have special permits, and all of them have applied to the Commonwealth, and on 3 of them we have received notice that the applications are complete, and therefore they ask the city to just say that whether there are, whether they've met the requirements, and so yeah, those 3 have. So we are now, and I've been discussing with the mayor, entering into sort of the second round of the RFP process. And so we had set up a meeting, but we realized it was premature given the fact, a number of factors. And we're continuing to work on this, and I've reached out to the consultant we have, Attorney Julie Steiner, to help us on some of these issues. The mayor the mayor has basically asked me to, review from a legal standpoint the process that we had and make any suggestions in light of the experience we had already, as well as changes that are going on at the state level. There's 2 important changes, or 3, that I'd like to talk about. The first is all of the state regulations are in the process of being reviewed, and the CCC is going to be coming out with those changes shortly. And until they do, we're really not going to be able to finalize what we do, because we may have to change it. The second is with regard to medical marijuana, and we as you know, we have to look at our existing process there, and we need changes in the ordinance to comply with the most recent changes that have been made at the CCC. In addition, the CCC has announced they're coming out with new regulations for the medical. And so again, that has to be put into implementation with whatever potential modifications we do with the second round. But the third aspect is on May the 26th, the CCC opened up the application process for what they call delivery licenses. And the interesting part on delivery licenses is it's a new license. And for the first 2 years, the only applicants that can put in for a delivery license are social justice applicants. So what we're looking at is trying to create an RFP process that focuses on the cultivation aspect, the continued retail aspect, and this delivery aspect. Do we do a process for each one? Do we do them all together? And what criteria should we have that's different from what we used before, based on the new regulations that are coming out and the new licenses that are coming out? The delivery licenses, we really got to get a handle on. Do you need a special permit for a delivery license? You'd think that it's more like Uber or something like that, where there's delivery, but perhaps there'll be, and we know the vehicles have to have very special security measures. And so where are these vehicles going to be stored? So it's a whole new area. But as I said, it is an area that is probably near and dear to everyone who's interested in improving the social equity aspects that are part of this legislation. So those are the aspects that we're trying to pull together. We need more time to wait to see what the state is doing with their changes in regulations, and we need to, as we have our current applicants move forward in the process, make sure that we get them opened as soon as possible, because this is important, I think, from a revenue aspect for the city, potential jobs aspect, and social equity aspect.
Thank you. So one clarifying question, Solicitor, for the delivery applicants, the social justice applicants, was that effective May 26th? Because we definitely don't want the time to run out on those 2 years. So would it be effective when we get our RFP process together, or is it effective from the 26th?
No. So on May, no. Yes, correct. It's the state just opened the application process. So, that's why, the Attorney Steiner works very closely with the CCC. There are no applicants yet. I mean, when we have some approvals of some licenses, I have been fielding questions from people who've been calling asking about it, and I've tried to direct them to the proper entities so that they can get more information, whether it's planning or whether it's health or whether it's the CCC. But people have been calling and asking about it, and I tried to give them as much information as I have on these new licenses.
I think I just don't want the time for the social equity applicants to run out while we're
definitely not.
While we're getting our process together. And so I just wanted to make sure that, I wanted to clarify if the 2 years is already started.
I don't believe it has.
Okay.
But, that is something that I will certainly be mindful of. And I'm sure that, I think it's important to all of us that we make sure there's opportunities that exist, because that's what the CCC has designated, as I said, as the limitations of those licenses. So,
and final question, sorry, President, I see your.
No problem.
Final question.
I didn't know you could see me, Counselor.
Yeah, I definitely see you. The 3 applicants that you said were approved by the state, so they can start building out now, correct?
I don't know. No, they need to get their provisional license approved. All I know is those 3 applicants have been designated by the state as having complete applications.
Oh, okay.
So it's a 3-part approval at the state. What happens at the state? There's the portion of what they call the people involved that need all of the background checks, and they look into all of those aspects, the background investigations, if you will. There's the portion that makes sure their application is financially sound, and then there's also and it has all the proper aspects there, but that qualifies for the statute. And then there's another part that has to deal with their management plans. And so those are the three aspects that the CCC looks at for all applicants. And as I said, that so 3 of the 4 that we have dealt with, we have received the CCC saying their applications are complete and we're now in the process of reviewing them. It typically takes about 3 months before they get the provisional license. And I think we've seen some construction activity begin even beforehand. So for example, I think on Boston Road, there's been some construction activity. I wouldn't be surprised if we're soon to see some more down on Columbus Avenue. I'm not sure what's been happening on Albany with 6 Bricks, but as I said, those are the 3 that I've received information that their applications are complete. As to Page Boulevard, I have not seen anything come through that says their application is fully complete. So I'm not sure where that is in the queue at the CCC. So does that make sense?
All right, so she must have had to leave. She said thank you. She said all set, and so it is now 12:30. With that being said, I think we're supposed to end at 12:15, so I appreciate everybody staying on the additional 15 minutes. My recommendation, solicitor, would be that that maybe you give us some sort of update regularly, potentially every 2 weeks, since this industry, is so important from my standpoint. During these update meetings, to the extent you can, if things have changed. Additionally, I would recommend that you look at cultivation separately. I know we looked at cultivation together this last time around. I never understood that. I think there are only so many people that are even going to be involved in cultivation just because of the amount of money that we're talking. And so it just seems to me that we should consider those applicants separately and potentially on a rolling basis. If folks are having a difficult time getting their facilities up and running that are just for the storefronts, then I can only imagine what's going to happen and the type of money that you have to have with respect to cultivation. On top of that, what my colleagues have said, I think remains true. Those are that's where the jobs are at. And so to the extent we can get that process started, it probably makes the most sense to have cultivation up and running as soon as possible. With that being said, counselors, thank you for indulging us during this hour. Solicitor, Commissioner, we appreciate it. And Lindsay, thank you as well. Counselors, you have a good
Thank you, President.
Thank you. Have a good weekend. Enjoy the 4th of July.
I forgot it.
Stay safe.